Hi everybody, welcome to the SNF Consolidated Billing or CB Getting Started webinar. My name is Tom Ryan, I'll be your presenter. Today we will be taking questions and information in the chat. Karen Curtis is going to go ahead and help me out with that as stuff comes in, so feel free to add information into that area if you want. A couple of things I'd like to keep you informed of. This is the first course in what is called SNF Consolidated Billing. Now, because this is such a big topic and not everyone needs all applicable items, what I've decided to do is to break this into 12 different courses. That way you're not stuck attending or learning about something that doesn't affect you or that isn't part of what you do. Now, for a skilled nursing facility, that does mean, unfortunately, there may be 12 different times you have to attend. For other facilities, not everyone will be applicable to you. Same thing for doctor's office or a lab. So you really are going to have to look at the descriptions to see which one affects you. But again, this is getting started. What is our goal for the day with getting started? Our goal for the day with getting started is, okay, sorry. I threw myself off here. Let's do some housekeeping stuff first. So first of all, I did already give you this, but I want to give it to you again. If you need that information, go ahead and go to our training center, go to our lab events page and download the presentation. Just going to give you a little bit of helpful information there. It will be available through the end of the day today or tomorrow morning. The presentation will then be removed from that page. It will become available again though when we do the encore presentation. So that will happen usually within a couple of weeks. We'll get that out there and it will remain out there for 60 to 90 days. So it's going to be there if you need it for a longer period of time. If you have questions, we'll take those in chat today. But if you have questions after the event, we're going to give you an email and you can send those in. You get 7 days to do so. After the event, I will be giving you an opportunity to take your survey. This is a great opportunity to give me future topics, how you thought I did, what I didn't answer or did answer during, what you have going on related to SNF Consolidated Billing, all of that information. So we're going to want to make sure that we do that, and we really appreciate your feedback later. Now, again, you'll see at various times, Karen will put a couple of different methods in there to get that information to you. Disclaimer, of course, we have to give you some basic disclaimers. Some of the information in here can change. Anyone that's worked with Medicare for more than 5 minutes, you know that there's many times that Medicare and the information changes, needs to be updated. You are responsible, or the provider billing Medicare and getting paid for a claim is responsible for keeping track of the official Medicare regulation. This is available on the CMS website, and this is also where some of the files are located. These files are updated, so we want to make sure that you're aware of when and how to check those files. That's going to be a little bit later on in the presentation. I will also let you know that I did receive some pre-submitted questions. I've tried to work as many of those into the presentation as I can. I will stop at various points to take more questions. So with that said, please put them in chat as they come up. But remember, I can only answer the questions based on what you gave me. So you start adding additional information or changing the question even a little bit, sometimes it will really change the answer. All right. So what are we covering today? Sorry, it looks like my PowerPoint decided not to move. There we go. We're going to put the building blocks out there for skilled nursing facility consolidated billing. This is, again, the starting point. Now, there is other courses that will give you some basic blocks, just like with this one. This one will just go more into detail about those building blocks to get you a better understanding. You do not need to attend all of the courses to get a full understanding or to basically understand the goals for today. To do that, I do want to define SNF Consolidated Billing or SNF CB and help you understand what it is and how Medicare uses it. We will provide a basic overview of SNF Consolidated Billing after we provide a definition. And then I want to demonstrate one of the biggest resources available to you, and that is on the CMS website. So hopefully if we get through all of these different things, I'll answer all of your questions. So how do we start off with? Well, of course, what do we have to start with? And that's the definition. If you don't know what SNF Consolidated Billing is, then you're already 3 steps behind the ball game when it comes to trying to make sure you're billing correctly when the patient is in a SNF stay. Skilled nursing facility is SNF. Consolidated billing, sometimes referred to as CB, just as an acronym there, so you could hear SNF CB. I will let you know that if I use an acronym and you're not familiar with it, please put that in chat. I want to know right away. I don't want to confuse anyone. That's really not my goal. Okay. All right. So what is SNF Consolidated Billing? My favorite answer to this question came from a provider recently, and she said, it's something CMS put in place to annoy me. Well, that's not really the goal of it, but I'm sorry you feel that way. The goal is to make SNF Consolidated Billing is a bundling program. It tries to bundle all the services so that the skilled nursing facility is responsible for services related to the facility care. Therefore, they can monitor and know what's going on with that patient under their care. That's why it's a bundled service. That's why it begins that way. But it also does have some other things that play into it. So what CMS says is, as part of this bundling service, we're going to pay the skilled nursing facility one fee for all services, and they will pay for outside services, contracted services, other services. There are certain things that are expected to be provided. But they do then go on to say, hold up, but not everything is possible in a SNF. SNFs can't do certain things. Well, if we think of their name, I can tell you when they're not going to be able to do. Skilled nursing facility. Facility means facility side. What is that? So that's the room and board side of it. So what does not fall within a facility side? For the most part, professional services will not fall within that. Now we'll talk about why I said for the most part in a little while, but I want you to keep of things like that. What they're really trying to do is take this one facility, the patient is inpatient and the patient elected to be there and staying there, and make them responsible for the services, working under contract with a lot of under arrangement or contract with a lot of different providers outside of that. SNFs do have two different types of stays, and this is something that I think some providers get or forget. First, they have what is called a Part A stay. Second, they have what is called a Part B stay. Let's work with that Part A stay definition first. During the Part A stay, Medicare is covering the inpatient stay. This is the room, board, basic nursing care, basic physical therapy, occupational therapy, speech language pathology, all of those things. Now, the reason that that's important is that it is only for 100 days in a benefit period. Whoa, what does that mean? We're going to define a little bit more about a benefit period and things like that in just a second. But let's talk about the room and board and the other pieces that are a portion of this. So the SNF, the skilled nursing facility, receives one payment. That payment then covers all of those. It's under a prospective payment system. So that's a little bit different than how the Part B services are, like a professional, a lab would bill, any of those. You guys get on a service by service basis. They don't have to come in chronological order. The SNF Part A stays do. All of those have to be in chronological order. So even the billing is affected by these two different types of stays. Okay, so remember, it's Medicare is covering the inpatient and there are only 100 days. A benefit period is a length of time. It can be any period of time as long as there is not a 60-day lapse in inpatient care of any kind. Inpatient care of any kind. So if the person goes back to the hospital with 48 days, and then after that hospital stay, 23 days later is released back to a skilled nursing facility, because of a time frame, there was not a 60-day lapse in inpatient care. While there was a 60-day lapse in skilled nursing facility care, that's not what a benefit period looks at. So a benefit period is the way in which Medicare measures the payable inpatient days, and you get 100 days per benefit period. One of the questions that was asked about this particular information is, what happens if the patient never goes outpatient, never goes below that skilled nursing level of care in their lifetime? And that can happen. So a person would never then get a reset of that 100 days. They would stay at it. The example given was a tube feeder, and the basic gist of it was they have a tube feeder who meets the Medicare requirements to stay at a skilled level of care. This is then someone who will remain in the skilled nursing facility in a skilled bed for longer than that. So does this person ever reset? And the answer is no. So you say, well, how does that affect consolidated billing? Well, that moves them into a Part B stay after that 100 days has lapsed. Now remember, Medicare is not covering inpatient during that Part B stay. Therefore, most services are actually billed directly to Medicare. So that's the first question you as a provider will have to ask. Are they in a Part A or a Part B stay? Now, a Part B stay is also when it is not medically necessary to remain in that skilled nursing facility. That's going to be a Part B stay. There's also something called a Part B stay related to not meeting the inpatient requirements before going into the skilled nursing facility. So Part B stay means for whatever reason Medicare is not paying that inpatient care. The inpatient requirement says there has to be 3 inpatient days, 3 qualified inpatient days before they go into a skilled nursing facility. Things that are not qualified inpatient days. Observation care. Okay. Not going to qualify. Yes, you're in a hospital, but you're in an outpatient status. So anything with an outpatient status. Anything over 30 days before you enter into the skilled nursing facility doesn't count. We have to have it within a certain time frame, and that 30 days is the magic number. So when we really look at it, first thing that every provider needs to do, including the skilled nursing facility, is determine, are they in a Part A or B stay? Because if they're in a Part B stay, these rules do not apply with the exception of one, and that is for rehabilitation services, PT, OT, and speech and language pathology. We're going to talk more about that in just a little while. So we want to make sure that we have all of those types of things aware of. One of the other questions that comes up frequently and that we do need to define is, what is an excluded service? Because when you talk about a Medicare excluded service versus a SNF CB excluded service, they're different. So Medicare excluded services, let's start there. That means it is never payable by Medicare. Somehow within the law, this is non-covered. So it's within one of the sections of the Social Security Act, it says it's not payable. That excluded service, that one service alone, is always patient liability. It doesn't matter that they're in a skilled nursing facility in a medically necessary stay. The skilled nursing facility cannot bill that either. Now, someone did ask a question and they said, the skilled nursing facility has a contract with us, and these types of services that would typically not be billable to Medicare are in that contract. Who do we bill? And the answer is, that is a legal and binding document. According to Medicare, we do not have an opinion on that, because now you have to get a legal consultation to determine the appropriate billing. So you need to ask, hey, does this go to, before we answer that question. From a Medicare standpoint, without that legal contract, if it is a truly Medicare excluded service, you would automatically bill the patient. This is different than a skilled nursing facility, consolidated billing, or SNF CB excluded service. What that type of service means is that it's not part of the bundled payment. It's not part of the one payment the SNF receives. Therefore, during a Part A stay, you will bill Medicare separately for that. Okay. This means the billing provider, the performing provider, will actually bill Medicare directly. So I don't want you to get confused over these terms, because they can be very confusing. In this class, when I talk about excluded services, we will be talking about SNF Consolidated Billing excluded services. The only time that they are not going to fall into that category is when I talk about a Medicare excluded service by using the term Medicare excluded service. You're going to want to listen for Medicare. If I don't say that, then assume I'm going with SNF. If you got confused, please put it into chat. I do not want to cause confusion. I do not want there to be issues with this part. Okay? So that brings us to the first opportunity you're going to have to ask some questions. Here's what I need from you. If you have a question, put them in chat. I do have a couple of pre-submitted questions that I will start with. I'll then call out to one of my coworkers. They're going to go ahead, my colleagues, what they're going to do is ask me any questions that are in chat or tell me there's not anything in there. So here's a couple of questions that we had pre-submitted. How will you tell if Part B will be covered? So I'm going to assume that what you're talking about is Part B patient eligibility. If I'm wrong, please put that back into the chat. You will need to check the patient's Medicare card. It will tell you if Part A or B is covered. If they do not have an effective date for one or the other, then it does not apply. Now, that doesn't mean that you couldn't check other things, and let me give you an example. SNAP, the Secure Net Access portal on our website, would be another useful tool. Why is this important? Because if the patient doesn't have either Part A or Part B, one or the other, then they may not have certain rules applying to them, especially if they don't have Part A coverage. Which leads me to another question. How could a patient not have Part A coverage? This came from a skilled nursing facility. My answer to you is that they did not work enough quarters in their lifetime to have free coverage. The Social Security Department and the Railroad Retirement Board look at 40 working quarters. It's 10 years. It is not straight 10 years. It is 40 quarters. They do not have to be consecutive. If they do not work 40 quarters, a person may be eligible for Medicare, but they have to pay what is called premium Part A. It's probably between 97 and 99% that have premium free Part A. But the premium Part A is expensive, so they may elect not to take it. In which case, these rules would never apply because you would never bill a skilled nursing facility because they can't bill Medicare because they're not covered. You'd always fall to the Part B section of it. Same thing would apply with Part B. If they're in that Part B, say, it's not going to be billable to the skilled nursing facility if they don't have Part B. Why? Well, the skilled nursing facility can't do anything with that. You can't bill Medicare for that either. They don't have Part B. They elected not to take that premium, or to pay that premium. Therefore, it's the patient's responsibility. A really good question came in, and it's why is SNF consolidated billing so challenging? And my actual answer relates to the fact that it's hard to get people to work together. You have people that hear, hey, I need to send a bill or I need to explain things. They get caught up in the laws like HIPAA, the Health Insurance Portability Accountability Acts, and they think, ooh, I can't do that. Ooh, that's a violation. It's not. It's needed for proper billing. So they get caught up in things like that. Along with items like HIPAA, people get caught up in whether or not this is done in this certain method with this certain thing and whether or not it applies and whether all of those are great questions, and that's what you're going to learn throughout the different courses. Now, again, this is a higher level overview, so we will go ahead and look at that a little bit more. All right, that's all I had for pre-submitted questions. I want to throw it out there and see if anyone on the panel has seen any questions come in the chat.
Hey, Tom, right now we do not have any questions that have come through in the chat.
All right, awesome. Thanks, Karen. Let's go ahead and move on. What we're going to look at next is what I like to call our overview. Now, we've given you a bunch of definitions, and as part of those, of course, it does build into having a little bit of the overview started, but this is really where the information gets together. So this is really where you want to pay attention. So first, the question that was asked, and I want to address this right out front. When you talk about SNF consolidated billing, what are the benefits, or why is SNF CB even in place? Again, it kind of relates back to the person who said that they thought it was to annoy them. And really, that's not the goal. The goal is a money saving or enhancement of overall care. Okay, what does that mean? Well, it allows the skilled nursing facility where the patient is inpatient to oversee and coordinate care. A patient who's in a skilled nursing facility can leave that facility from time to time. They may be in a rehabilitation style care where actually leaving that facility is part of the rehabilitation. If they don't leave that facility, they'll never be able to see if they can truly make it outside of the facility. Now, there are some patients that are not allowed to leave that facility, and it really just depends on the patient and each individual. But we also want to make sure that the SNF is aware of what's going on with their patient. Ultimately, their decisions can be affected, such as whether or not they need to do an evaluation, whether or not they need to look at PT, which is physical therapy, occupational therapy, speech language pathology, whether or not they need to work with a social worker, all of those types of things. So there are certain types of things that a SNF can't do as well, and those are what we're going to talk about when we talk about the excluded SNF consolidated billing services, okay? So it allows this overall care to be part of the SNF. One of the big things that this was put in place for was to lessen burdens on the patient for out-of-pocket expenses. What was previously happening before consolidated billing, before this type of bundling came into play, is that the patient still has a certain out-of-pocket expense when it comes to the skilled nursing facility benefit. But they also have an out-of-pocket expense for each Part B benefit that was not billed to the facility. So if you think about that and they go outside of the facility and they have an x-ray done, or they have a certain type of care done, or they have physical therapy done, well, that's supposed to be part of why they're in the facility. That's part of what the rehab, the skilled nursing facility is doing for them. It's the skilled care. So they're also getting that on top of that, the 20% or Part B deductible. And CMS wanted to reduce as much of that burden as they could, and so did Congress. They heard that that was a problem for people, so they wanted to reduce that. It also eliminates duplicate billing, which then protects the Medicare trust fund from paying things it shouldn't. So it's very important that this happens. It is very key that we have that duplicate billing eliminated as much as we can, and really makes Medicare pay for things they're responsible for, puts the responsibility back onto the SNF where they're responsible. It also puts the responsibility back onto the patient for those Medicare excluded services so that they're responsible for the items they need. So hopefully all of that makes sense and answers your question about why it's even there. Again, no, it is not to annoy you, though I do love that comment, and thanks. That was a great chuckle for me. The next question, when we talk about an overview, is who's affected by this? And really the answer is a lot of people, a lot of facilities, a lot of everything is affected by this. So a hospital can be affected by it, so can a critical access hospital. Now, swing beds at a critical access hospital are not affected by this, but a critical access hospital can also do things like lab work. And because they have a lab, those could be affected. They can do certain diagnostic testing. Because they have that type of testing, that could be affected. So the question for critical access hospitals is absolutely they are affected. Imaging centers, ambulance suppliers. Now that one's unique and got a lot of rules that go into it. We're not going to fully get into that today. I will talk a little bit and highlight some different things with ambulance suppliers, but I do want to let you know that that one has its own class. Ambulance suppliers, you have your own class, maybe in a couple months from now, but it'll be coming out for you. Radiology centers, rehabilitation therapists, whether in private practice or not. So they are definitely affected, and physicians. Now, I want to remind you that though physicians perform professional services, they can also do interpretation of diagnostic tests. So that's what we're looking at when we say a physician's affected. So if you said, hey, they went to an office visit, or hey, they went to this, that can also be affected in that they're inpatient in a facility, and we expect that that type of place of service on their bill reflects that. So even though you saw them in your office, the place of service is affected. So a physician is affected. This can, in some cases, reduce the fee that physician would receive. Now, I will tell you, when I say physician, I'm also going to include non-physician practitioners here, such as a physician's assistant, such as a nurse practitioner, all of those other types of practitioners. So if you need more information on any of that, please put that into the chat, and I'll get that for you in just a few moments when we get to that additional question section. Who's not affected? And I want to be as clear as this is possible. Critical access hospitals, I just said they were affected. Swing beds, which is a designation where a hospital in a rural community or a small community hospital meeting the criteria for critical access hospitals, they can have a bed designated as a skilled nursing facility bed versus a regular hospital bed, or both. And because of that, that type of bed is not affected. It's a different situation. It's a different type of billing. Rural health clinics, your billing is different. Therefore, if the service is paid under the Rural Health Clinic Prospective Payment System or the payment you get for the RHC, then it's not affected. Same thing with a federally qualified healthcare center. So we were asked about those two in particular. I put them on the slide for that purpose. They are not affected. Now, if you said that your federally qualified healthcare center owns an independent diagnostic facility, in other words, yes, I understand they're a federally qualified healthcare center at this location, but they have this other stuff going on, The other stuff can be affected, whatever that happens to be, okay? So it's very different when we look at those two types of items. All right, so how does reimbursement work? Well, reimbursement is an interesting aspect because in 1997, this law was put into place. Under this law, this policy, skilled nursing facilities are reimbursed for Part A and B services provided to their residents. The key with reimbursement is only during a Part A stay, with the exception of rehabilitation services for PT, physical therapy, OT, occupational therapy, and speech language pathology, SLP. Any assistant related to any of those services would also then be underneath there. What it also looks at is services that are required to be billed to the skilled nursing facility. Now, their reimbursement is not done on a daily basis. Their reimbursement is not done on a per item basis. Skilled nursing facilities are required to be reimbursed on a prospective payment system, which means they bill monthly. This is different than someone who is billing Part B and who does not bill monthly. You could actually bill most of Part B, even outpatient hospital services, as they occur. However, that's not how the SNF works. And a SNF claim must process in chronological order. All of January processes before February. All of February processes before March. So with that said, if you're billing the skilled nursing facility for certain services, you as an outside provider can actually affect their reimbursement. If they're suddenly getting something in and now they have to go back and adjust a February claim, it can stop future billing and future payments. That's why it's important that everyone works together. And we do have a class coming up and we'll talk more about that. But I wanted to make sure everyone understood that first, the SNF does have to bill in certain orders. They do have to have things in certain timelines. Okay, this is different than Part B providers who can bill anything they want in any order they want, and they can bill multiple or single claims. SNFs do not get that luxury. They have to bill one claim for all of their service. Okay. The next question that we got in relates to this next slide. And the next question that we actually got in is, how do I know what are the services that are included in consolidated billing? And this is where we really wanted to talk about all of this type of information. Now I'm going to give you some general explanations here, and then I'm going to go into this more when we look at the website, because there's some different things you need to be aware of. And those are actually going to be in the next section, because I wanted to keep that separate. So I'll give you some general information, and then we'll go through the website stuff a little bit later. So first, we did talk about a Part A and a Part B stay. Part A stays mean that Medicare is covering the inpatient care to the skilled nursing facility. As long as the patient remains in a skilled nursing facility, skilled bed, then clinical social workers are part of that. Their services are portioned off to the skilled nursing facility. Incident to services provided by any provider would be billed as part of that. Preventive and screening services must be billed by the skilled nursing facility. They are separate payments from the daily rate, but they still have to be billed by the skilled nursing facility. That means that if for some reason the patient came to you in your office and had a preventive service during that time, or a screening service during that time that they were actually inpatient, you must bill the SNF for that. It's part of their responsibility. They're going to pay you back for it. And then it says, in a general and generic rule, Medicare covered services. And you're like, oh, well, that doesn't really mean a whole lot to me because I don't know what all that entails. As I said, we will get to those files a little bit later on, but I wanted you to at least be aware of it. Now, there is what is called a Part B stay. During this Part B stay, the SNF is still responsible for all rehabilitation services. This means physical therapy, occupational therapy, and speech language pathology. They are the only ones who can bill it. So if for some reason one of their patients comes to you and does any of those always therapy services, then you must bill the SNF for that. So we have to really look at, again, determining who's responsible before I can say yes or no to what services are included. And again, we're going to get a little bit more into this question in just a little while. All right, are there services or categories that are billed directly to Medicare and not the SNF? And the answer is absolutely. There are some categorical services. One, most physician services. We say most because if you're doing a professional technical component, so if you're doing the interpretation component, sometimes those are not, but they're still considered a physician service. So we're going to look at the files that'll talk about that. Emergency room services. Uh, Nope, that place of service is excluded simply because the skilled nursing facility can't do that. The catch with it is if it's not billed correctly, then it could include even though it shouldn't be. So depending on how the billing comes in. There's also some services that are outside the scope of a SNF, maybe like a CT scan, some chemo services. The SNF just typically doesn't do these types of services. They're not available to them. Now, there are always going to be caveats, and that's what you're going to learn if you attend other courses is all the different caveats. I will show you some of those types of things. Um, Always excluded from SNF consolidated billing is any Medicare excluded service. If Medicare isn't going to pay you because it's not part of our program, we're not going to pay the SNF either. Therefore, it is the patient responsibility unless you have a separate legal binding contract, which was the question asked earlier. Also, telehealth originating site facility fees are excluded. Okay. But that again has to be billed correctly as a telehealth code. And we have issues come in with that where we've done a little bit of analysis and we don't see those being billed quite right. So before you bill Medicare, before you just automatically say, I'm going to bill this to Medicare, it's your job to determine who to bill. We'll talk more about that. Now, if you're billing Medicare, you do have to follow the Medicare billing guidelines. They don't change just because the patient's in a facility somewhere. So that does require you to use the correct place of service, etc. If you want more on that, please feel free to put a question into the chat. We'll talk more about that. Does a SNF bill as they are provided or like our labs? Okay, so I'm not really sure what you wanted with that question, but it relates to the SNF billing question. So when we look at it, a SNF payment and billing are affected by late services. We talked about that. Remember, a SNF must bill monthly and then a final discharge bill. The final discharge bill can either be because the patient is leaving their facility for whatever reason, or it could be that the patient has passed away and is no longer needing it. Also, it can be because the patient is staying in their facility but does not meet the Medicare requirements for medically necessary skilled nursing facility care. Hold on one second, I'll be right back. I apologize, I didn't want you all to hear my cough. So when we look at that, that's what we're talking about with a discharge bill. Now, for those of you that are in a facility, you understand that concept, but for those of you that are not, sometimes that discharge bill gets a little confusing. Now, when we look at the SNF bill, as I said, it has to be paid and processed in chronological order. They can't even submit a second claim for the second month if the first claim gets stopped, has an issue, if something happens. So it is not like the lab service that the lab itself can submit. The lab itself can submit the service any way they want. Yep, goes out today. It's an outpatient service. Yep, cool. Goes out today, even though it was yesterday. Awesome. We're not looking at that. Now, there are some outpatient services that do have to be submitted on a monthly service charge. It just depends on how you look at it. But those are facility outpatient services, not necessarily like professional or things that are billed on a 1500 837P electronic transaction. So hopefully I can answer those questions. What I'm going to do now is move into our next set of questions. And again, I'd like to start with a couple of pre-submitted, this giving you guys the opportunity to throw questions into the chat, and then we'll go from there. When would this not apply in the SNF setting? This does not apply when the patient does not have Part A. They don't have it, so no skilled nursing facility consolidated billing. This does not apply when they've used up their 100 days during a benefit period of SNF inpatient stay care days. If those 100 days are used, this doesn't apply. Also, this doesn't apply if there is no what is called a 3-day qualifying stay. Clarification on that, is it 3 calendar days? And the answer is no. It is 3 midnight census before and after, and you have to have 3 days. So the day of discharge doesn't count. The day of admission would, because they would be in at that midnight transition. The next day they would be in at that midnight transition. The third day they would be in at that midnight transition. And then finally, the 4th calendar day would be the day of discharge, but they would not be in at that midnight. So they did have 3 qualifying stays. So that's when it doesn't count. Next question, can a hospital outpatient clinic or private practice outpatient clinic bill for physical, occupational, or speech therapy services provided under Medicare Part B to a long-term care resident of a SNF? This one gets a little bit more complicated because a long-term care resident may not be necessarily in a skilled nursing stay anymore. They may be living there. There may be other factors that go on. So first, they do have to meet one, the 3-day qualifying stay. Second, outside of the 100 days of skilled care. Third, if it is medically necessary that they're still in a skilled bed, then you would bill the SNF. If it's not, and they're just in the facility on long-term care for whatever reason, maybe they've elected or maybe that's where they live at this point, then you would not. So this one is not a straightforward answer. There are multiple components that go with it. Okay, I would like to open up for questions again. So do we have any questions that need to be answered?
Tom, we have gotten a couple questions, and I just want to throw out there that some of these may just be personal experiences. So I just kind of want to put that out there before I ask the question. First question is, why does a SNF need a Medicare EOB to pay a claim? I bill hospital charges, and when a patient is in a SNF, the SNF wants a Medicare EOB, but sometimes we haven't billed Medicare because the SNF is responsible. Shouldn't the SNF know what they should and shouldn't pay for the services that I bill?
We can't actually tell you why a SNF would want that EOB. I'm not sure what they're trying to do with it. Maybe they're trying to ensure that. The reality is, if you know that it is their responsibility and you are billing Medicare for that just to get that, that can be considered a fraud or abuse. I shouldn't say fraud. It's really abuse at first and then can turn into fraud. So, but if you're doing it at the SNF's behest, if you're doing it because they're telling you to, document that. Make sure that that's documented so that if Medicare ever comes back and you or anyone ever questions you on it, you can say, look, I didn't have a choice. If I want to get paid, the SNF is telling me I got to bill Medicare. So go after them or talk to them about that. They should be able to look up the same files that we're going to go through in just a little while and be able to tell whether or not they should be paying you. Hopefully that answers your question. If you want a little bit more, throw that back into chat and we'll get that information from there. Next question.
Next question is, do physical medicine and rehabilitation physicians bill Medicare or the SNF?
Oh, this is a most wonderful question. And it's actually not as easy to answer as you think it should be. It should be yes or no, right? And that's just not how it works. What it really looks at is the service that you're providing and whether Medicare classifies it as one of those rehabilitation, physical, occupational, or speech language pathology services. If it's classified as a therapy service, it is billed to the SNF because they're responsible for it. If it's classified as it could be done, but not necessarily be done by a therapist, and it's still classified as something that may fall into your categorical, then no, that would be separately billable. The one that jumps to my mind, and I'm going to see if Mary Sue has another example after this one, but would be wound care. Wound care can be done sometimes by a PT, it just depends, but it's not always done by a PT. So that's one that jumps to my mind. And I'm going to see if one of our registered nurses, our nurse analysts on the team, Mary Sue, do you have any that come to your mind? I don't have anything other than that. Okay, not hearing Mary Sue. I'm going to assume she does not have any feedback on that one, and we're going to go on to the next question.
Okay, what steps do we take if we are billing the SNF for services and they are not paying us, but billing Medicare and getting paid?
So the SNF is not paying you. The SNF is billing Medicare. That's what I'm understanding from your question. If I'm wrong, please provide a clarification. If the SNF is responsible for paying you and they're not paying you, this is just like any other type of course that you would take to get money paid that's owed to you. So it's a legal process. It doesn't have anything to do with Medicare. Now the SNF is violating their participation agreement. It's the same thing that everyone signs when you become a participating facility. There's rules that go with it, and part of that is that you're going to pay services you're responsible for. So I want to make sure that you're aware of that. I would say follow your normal billing processes, consult a legal consultant to find out your recourse actions. And I want to see if Mary Sue did have anything on the last one. I saw that she came off of mute. Mary Sue, did you have anything?
Hi, Tom. Thank you. So sorry. I was double muted. And no, it was the exact same scenario of the wound care that I would have provided as well.
Okay, thank you. Just wanted to make sure, again, sometimes that clinical expertise helps me out a little bit there. So with that, we'll go on to the next question if there is one.
It looks like that's all we have for right now.
Okay, awesome. So I want to make sure that you guys are aware that these next files are based on and the first resource I'm going to come to, because this is your big resource. This is your big dog one. This is the most important file in determining who to bill. Okay, so start with one. Do they have Part A and B coverage? If they don't, we've already done that determination, right? Now we're going to go on and say, oh, are they in a Part A or B state? Okay, now we know that they're in a Part A state. Now we're going to go ahead and move forward. Oh, nope, they're in a Part B state. Now we're going to look and see if it's physical, occupational, or speech language pathology. If it's not those services, we're done. But now we have to go service by service. And this is procedure code by procedure code to determine whether or not you have to build a skilled nursing facility. And how do we do that? We need to start by first going to the CMS website, and we're going to the SNF Consolidated Billing webpage. So what it's going to look like. I think it's so important. I'm going to stop my PowerPoint and I'm going to show you where this is located. Okay. So if you want the exclusions, you're going to come out and you're going to go to cms.gov. This is the website. Blow it up, make it as big as I can. Okay. When you do that, we are talking about Medicare. These are very specific to Medicare. So we're going to use the designation for Medicare. Then we're going to come down and you can see it opened up a pop-up, and we want to go to coding and billing, right? Consolidated billing. Go all the way to the right side. And in that right-hand column, the second item is called Skilled Nursing Facility Consolidated Billing. By clicking or selecting this, what you've done is opened up a page that explains everything I just went through, only in a lot more detail and with, a lot more general information that you might need. I recommend this is a great place if you're first trying to get started. Take a look at any of this information, okay? I wanted to show you this related links at the bottom because these are where you could find information on consolidated billing in general. Also on transmittals. For those of you that do not know what a transmittal is, we have day-to-day operating instructions. They're in the manuals system, otherwise known as the internet-only manuals. Transmittals are the information that updates them before they're actually put into the manual. So CMS may tell you and us together and say, hey, we're going to do this now. That's what the transmittal will do. And then eventually that will be worked into the manual that it affects. Okay. So important that we check at that. On the other hand, if you were to read the consolidated billing section in the manuals, it says, hey, you got to go out and read these files. Well, what are the files? These are the actual files right here, what we're looking at. There are two different sets. One is a Part B MAC update. Okay? Two is the Part A MAC update. These are not related to certain types of services. It's the patient's stay and the service provided. So it's a categorical base. So let's go ahead and start with this file for the Part A update. If we select it, it'll give you the updates. What's occurred since that file was published? So again, I just clicked on the 2025 file, and what it's, sorry, I did not mean to make myself switch there. It's going to tell you, hey, in certain categories, certain things have been updated, and it'll give you a code with those updates. But if you scroll all the way to the bottom, what you will see is first, under downloads, and I apologize for the fast scroll there, hopefully that didn't bother anyone, is the second file, and this is where you start. So downloads, second file. Now the other one is the zip file. We're going to look at that in a little while, but if you don't read the second file, you won't understand the first file. You won't understand it. Second file explains all of the caveats that go into this. This will be a separate class. We will go through every caveat, every major category. We're going to look up procedure codes and do all of that during the class. There's just a lot of, there's a lot of little pieces of information. I'll use an example here. If we're looking at anything that falls into major category 1, these are excluded because the SNF typically cannot perform them. Therefore, they're not by the SNF, except they have to be done on an outpatient basis at a hospital or critical access hospital. Well, some of these could be done at a freestanding diagnostic facility, except if they're done at a freestanding diagnostic facility, they are now included because they do not meet these requirements. Now, this is all within the manual system. What happens is they bring it out, they put it on this stuff to make it easier for all of us to read and to find in a much more user-friendly manner. So there's a variety of different things if you want to go ahead and look that up. So when we look at that, it then says, okay, what is the final procedure code being billed? And it goes further to say, if you're looking at major category 1, we're going to generally subcategory those into a variety of different types of information. And then some of the subcategories even have further explanations just to make it a little easier on us all, right? All right, I know that that was tongue-in-cheek, I get it. But so let's go ahead and say again, this was performed in a hospital or a critical access hospital. So as long as we do a CT scan, maybe an MRI, we're good. But if it's not, then it's not going to be good. Okay, but let's move on. Here's outpatient surgeries. I want to point this word out. So if we're looking at major category 1, subcategory F, you'll see it's called an inclusion list. This is done because there's too many surgeries a skilled nursing facility can't do. So these are the ones they can do. So these are what are considered surgical or other related procedures. Okay. Same thing on the emergency room services. But here's that caveat that I told you, the emergency bill must have a certain type of coding on it. And if it does not have that revenue code on it, these services will not be excluded. Even though they were done in an emergency room, if it wasn't billed correctly, they're going to include. I was very specifically asked about the next category. This is the one that I told you we're going to teach a whole separate class on because it gets very confusing very quickly. Okay. Ambulance trips. With applicable to major category 2, if you read the full note, it tells us if we're looking at major category 1, A through E and G, that the ambulance trip is based on what is being billed and doesn't meet the requirements. Same thing with 2A. So this does look at a variety of factors. So if an ambulance trip is to a destination and the service at that destination is excluded from SNF Consolidated Billing, then so is the ambulance trip. If the service at that destination is included in this form of bundling, then so is the ambulance trip. But to add another caveat, the ambulance run is not billable on the inpatient claim, on that Part A claim. It has to be billed as part of the procedure. So you can imagine this gets super confusing super fast. So we'll talk more about that in a little while or in another class because I could spend an hour just talking about that. And so you can go through and you can read all the different categories and major information here. Again, with this is something that is done in an Excel file. So if we open it up, we will have an Excel file available to us. Give me 1 second because the Excel file is not going to open real quick today. Oh, there we go. We're going to go ahead and throw this on my desktop. And it's going to download a file. And the file is actually going to be something that when we look at the desktop, it's going to allow us to open up a zip file. Now the zip file is just a way of compressing it, making it a little bit easier for everyone to read. Here is what this file looks like in the extraction. And you can use either one. It's just one is 508, one is not. So go ahead and pick whichever one you want. And you'll see how this is listed out. Now, I'm not going to get into reading this file directly because I did give you the explanation. We are going to go ahead and open the file, take a quick look at it, and move on. So hopefully you can see the file, and here you can see here's the procedure code. Here's a short descriptor, which is great. If there's a modifier or something else, we would want to note that. And then here's your major category. This is where you have to go back and read that other document to be able to tell which one goes into it. So hopefully that makes sense. And again, you can look through the pages and pages and pages that go with this. If you want more information on that, take a check next month. That's where we're going to just cover this file. We'll get more in depth into this file. Okay, the other file that we do want to take a quick look at is going to be our Part B file, and that's up here. And one of the things I want to point out with this one is, did you note that they put additions right here, right at the beginning for you? But then you'll get down into these different files down here, and each file will explain at the top a little bit about what it is. So it's going to be a little bit different than the other one in that this one will help you a little bit more at the top. I'm not going to open each file up. That would be a little time consuming, and we don't really have time for that. What I did is just opened file Part A while I was talking so that, open so I can show you. Or maybe not. Oh, there we go. Sorry, it's just loading, so give me 1 second here. So remember, Part A is physician services. Physician services are also going to incorporate the non-physician practitioner services. So here you can see that's all explained. I do want to point out this line right here because this would be in Part B, or I'm sorry, in File 2. That's what File 2 is all about. And then it tells you which services you should bill. So File 1, providers effective for claims, professional services other than beneficiaries in a Part A covered stay. These codes are not subject to, they should be submitted directly to. So hopefully all of that makes sense and kind of helps you read those files a little bit more. Again, we will go through in a couple of months to get through all those different pieces of information. We don't want to save that. I'm going to jump back to my PowerPoint here, kind of look away because I just went through almost all of my slides. We talked a lot about these different types of things. So got some different resources out there for you if you want to learn about any of that. We do have some time for questions, just a couple of minutes. Let me see if I have any pre-submitted I still need to cover that you guys might be interested in. Oh, blood transfusion. I'm sorry, this is the one that I was looking for. Blood transfusion for patients in a Part A covered stay. This is procedure code 36430. If we look at the file, it's going to be a major category 1F, which means it's in the inclusion file. So if you're looking for the blood transfusion, please check the Part A files. Remember that to be in a Part A stay, and it is in the exclusion, or it is in the inclusion portion, major category 1F. With that, any questions in the chat?
Tom, we did have some clarification on a question that was asked earlier. It was from Lauren when she asked about the physical medicine and rehabilitation physicians. Do they bill Medicare or the SNF? And she said, just to clarify, PMR providers are not providing therapy services, but providing pain management or overseeing rehabilitative care in regards to functionality and return to their home. And then those providers should bill Medicare, such as evaluation and management services. Also, if a patient does not have Part B coverage, would PMR physicians not providing therapy services bill the patient? I'm sorry, that was a lot.
No, that's actually perfect. So yes, the evaluation and management or whatever type of service like that is considered a purely straight professional charge. If you go to the second list that I showed you, the actual list from the Part B File 1 list, they're going to be listed on there, which means bill directly to Medicare. Please make sure that you use the appropriate place of service. Second, if they do not have Part B coverage, it is the patient's responsibility. Medicare cannot cover a Part B service if the patient simply doesn't have it. Next question.
That was all we had for now, Tom.
Awesome. Okay, let's go ahead and move on. So CMS is also focusing on achieving the highest level of health and well-being. This is called Health Equity. They have a full website. If you're interested in learning more, I do recommend take an opportunity to take a look at this information. It's really about giving optimal healthcare regardless of any contributing factors and really focusing on patient care. So I will give you guys the opportunity. If you're interested, check that out. I asked Karen to put a link down in the chat. Hopefully she did that. Karen or Mary, so I'm not sure who did that one for me, but thanks. Want to remind everybody that we are going to send you a follow-up email. The follow-up email does contain your certificate of achievement for this class. It also contains a link to the survey. I'll talk more about the survey in just a moment, but I want to make sure that you're aware that the certificate of achievement is in here. This certificate of achievement is something that is needed for continuing education units. Yes, I had 3 questions submitted on that. We do not offer continuing education units. We do give you contact hours. Contact hours are then used by governing bodies to determine whether you're eligible for continuing education units. We don't actually do that. So please make sure that you keep this email, open it up, check it out. If you called in and you did not give an email when you called in, because you don't have to, then you will need to email us, and those will come in just a few seconds. I'm going to give you what's called the follow-up slide, or not. I'm stuck again. Yeah, I'm going to give you the follow-up question slide. This is what you're going to email for me. What I need you to do, if you have a follow-up question or you need this survey, you have 7 days, y'all, 7 days, and you're going to email me at the email provided here. In the subject line, put SNF CB. That's all I want. I want SNF CB in that it will help me understand what class it goes to. But you also, if you're asking for a survey, you need to give me an additional piece of information, and that's the phone number you dialed in from. Area code, then the 7-digit number. Without that, I can't do anything with it. I'm going to email you back and say, hey, what was the phone number? So let's just go ahead and solve that right up front and not do that. Please remember that if you have something that is claim specific, it's already got an internal control number or a claim number assigned to it, CCN number, whatever you want to call that. It has to go to customer service, and you have to ask through customer service. You're asking for an explanation of what happened with the claim. Do not say, hey, this denied. We don't want that. We want an explanation of what happened, why it denied. We understand it's denied. You want a further explanation. If you simply say, I don't understand what happened with the claim, what they're going to say to you is contact one of your self-service tools to get your claim status. I want to make sure we're clear on that. Survey. All right, I'm going to have Karen add a chat link with this one. I want you guys to take the survey so bad that I already told you one opportunity you're going to get, and that's through that follow-up email, but I'm not done yet. If at the end of this course, I'm going to go ahead and close it, it's going to give you a little pop-up box. It's going to look like that one on the lower right, the external site. We really want to hear from you. We want to know what I did good, what I could have done better. Were the resources helpful? What would have been better for you for this experience? We also want your future topics. Please take a few minutes to complete this survey. It's not a very long survey, but it really will help us in the future. More to come on this topic is definitely going to happen. Watch for it over the next months. Determine what areas you're interested in. Did you want to learn more about the Part A file? Did you want to learn more about Part B files? Did you want to learn more about working together? Did you want to attend the ambulance specific one? Or maybe you want to attend one that's about interpreting a diagnostic test and how all of that works. Please incorporate that into the survey and then attend the appropriate one to come. I'd like to thank you guys for listening. I want to encourage you again, provide that feedback. Remember, we want everything we can to help us in the best way we can, and this includes future topics you'd like to see. I will encourage you to sign up for other webinars by watching our live events page and signing up for those. They're a big part of SNF Consolidated Billing. So on behalf of Karen, Mary Sue, myself, all of Provider Outreach Education, and WPS, thanks for participating. We look forward to your survey comments, and we hope that you'll attend more education in the future. You may now disconnect.